Hi there, this is Dr. Heather Harrison. I'm a family physician at the Central Utah Clinic in Provo, and today we're talking about how to check your IUD strings. What an IUD is an inner uterine device that often women use for prevention of pregnancy. There's a Mirena IUD that can last up to 5 years. There's a Paragard IUD that can last up to 10 years. How these IUDs work, again, the Mirena IUD works by having a progesterone hormone that's slowly excreted that prevents ovulation. The Paragard IUD works by changing the pH inside of the uterus so the sperm don't survive if they make it up there. And they both have a little string that comes through the cervical opening. One, that's how we get the device up in there and how we remove the device as well. But the string that comes through helps with the protection for prevention of pregnancy. But it's also important to make sure that you know that your string is there and that your IUD is in a good place. Usually we recommend checking your strings every month. Usually the Mirena IUD string I describe as feeling like a guitar string, and the Paragard IUD strings feels kind of like fishing line. A lot of times the strings will just wrap around the cervix over time, so they are a little bit more difficult to find. So usually when you're checking for your strings, what I recommend is you reach all the way up into the vaginal area, reach up till you feel something that feels like your nose. The cervix kind of feels like the tip of your nose, and you kind of want to do just a sweep around there and see if you can feel the strings that are there. If you ever feel like you can't feel your strings, you should visit with your provider so they can actually take a look and see if the strings are present. If not, then they would need to do an ultrasound and see if that uterus is kind of sucked that IUD up a little bit, or if somehow it's been expelled without you knowing. Again, this is Dr. Heather Harrison talking about how to check your IUD strings.